I was referred to Dr. Robles by my MD, and I have problems with my back, but I started having problems with my wrist, and Dr. Robles did injections, and my wrists are getting better. My hand wouldn't close all the way. And since Dr. Robles had been doing injections, I can close my hand more. So, I mean, he gave me injections in my back, which is helping, and he put me on some medication. Before, I could hardly get up and move around. And if I held stuff, I would drop it because my hands would go to sleep. So before I ever came to Dr. Robles, this is my life how it was. I had to have help getting out of the bed, and my kids would bring me stuff so I wouldn't have to hold it too long, and since I've been coming to Dr. Robles, I do a lot more around the house. I get up by myself, and I hold things a lot more than a few seconds now. My family, well, my kids would, they tell me I'm young, but they would cry a lot to see me like this. And my family, my sisters and brothers would check on me all the time. But my kids mostly were the ones that took care of me. My life right now, I go a lot more places. I do a lot more things. I walk 15 minutes a day, but I do a little more than I've usually done in the past since I've been coming to Dr. Robles. Dr. Robles is he's got very good bedside manners. He's a very good man, and he gets to the problem and he solves it. If you live in the San Antonio, Houston, in the Valley, just give Dr. Robles a call. He will be glad to help you with whatever problem you're having.
Hello, my name is Dr. Robles from New Pain Solutions Clinic. I'd like to comment on Norma's treatment. Basically, Norma was a patient long-standing who had complaints of wrist pain and also tingling and numbness over the area of the median nerve. That is called carpal tunnel syndrome. It is a frequent neuropathy, very common in our population. The causes of carpal tunnel are different reasons why a person can have it, from a hormone imbalance to trauma. In this case, the treatment that I applied was platelet-rich plasma. What I did was I isolated the platelets and concentrated the platelets, and I then, under ultrasound, injected the platelets around the nerve. I also treated the ligaments on the other side of the hand, because frequently those ligaments are weak and painful. And in a carpal tunnel, if you think of the bridge in the carpal tunnel, and if these ligaments are leaked, the actual carpal bones can actually cause compression of that nerve. So I treated her ligamentous structures in her hand, as well as what I call the hydrodissection. I used an ultrasound guided needle to specifically inject around the nerve, decompressing it, but using platelet-rich plasma. I was very happy that she had great results from this treatment, and certainly this is a treatment that doesn't necessarily have to go to surgery, and certainly if one doesn't want surgery and have exhausted basic conventional treatments like a nerve block or splinting, this is certainly an option that is very non-invasive, essentially painless, but gives long-lasting results. Thank you. My name is Dr. Robles. If you have any questions, please call this clinic. Thank you.